We work out how we can reduce £6.5 million out of the adult social care budget, and I think you've said that you've got a good relationship with the Hammersmith and Fulham officers who are responsible for helping discharge, which must be a big part of it. It's a big part of the problem of the process. Is there anything else we should be doing? Is there things which you are aware of that we're not on top of?
So, probably two things I would say, which is that we still work in effectively either the social services discharge team, a community discharge team, a hospital complex discharge team. And I think something over the next 12 months we need to see how we can actually bring a single team that are working to manage the interface between acute, community and social services together, as opposed to having a number of different teams that hand off together or hand off between each other, because that's still an issue. We still have processes which we have to follow through and hand off into other departments to actually get something like a complex issue, or sometimes a simple issue like an appropriate bed located in a patient's home, to get them out in a timely fashion. And I think some of the handoffs between teams who are working very hard and very actively together are probably could be minimised if we actually just looked at having one team that covered health and social care to manage acute into community and discharges. So that's one thing. I think another thing which I've seen around the country that's come out of some of the developments around the Better Care Fund is actually a much more proactive approach, which is about discharge to assess. So we still have, to a degree, processes and form filling to get to the point of being able to then have someone come into an acute organisation to make an assessment about someone's ongoing care needs. There are systems around the country who are moving much more to a discharge to assess approach, where we will look to get a person discharged from an acute organisation into an appropriate safe location to have their ongoing assessments undertaken about their either health or social care needs, because often it is unclear whether it's a social care response that's needed or it's a health response that's needed as the primary support. But whilst that decision making and assessment is being undertaken, often patients are sitting in an acute hospital, which is not the best environment for them. So I think those are two things that I think we could actually develop over the next 12 months.